So, the genetic disorder is Huntington's disease. The early symptoms that we can see from this is difficulty concentrating, memory lapse, depression, including low mood, a lack of interest in things, and feeling of hopelessness. Stumbling and clumsiness, mood swings such as irritable or aggressive behavior. There's also anxiety. The later symptoms that can be seen are involuntary jerking or fidgeting of movements of limbs and the body, difficulty speaking clearly. Eventually, they may find all communication very difficult. Swallowing problems, they may choke on the food and get lung infections from this, from the food going down the wrong way. Increasingly slow or rigid movements, personality changes. Sometimes they may change so they don't seem like their former selves at all. There's breathing problems, and then there's also difficulty moving around. They may eventually lose the ability to walk or sit up by themselves. The issues created from this disease, there's uncontrollable movement of legs, head, face, and upper body. It also causes a decline in thinking and reasoning skills. You get memory problems and a hard time concentrating from things, poor judgment, and the loss of ability to plan and organize things. Systems that it affects the nervous system because they can start to lose their ability, with their nerves that involve it, such as feeling things and their brain thinking. There's the muscular system because you have a hard time controlling your muscles when your limbs start moving on their own. The digestive system because when it's hard to swallow, so you can't get enough food and your digestive system has a hard time working properly. Then there's also the cardiovascular system with people that have Huntington's disease will experience a high rate of cardiac events. The body doesn't really have a way to deal with this disease since it's targeting the brain, which is a very specific method that the body has to work with. It doesn't really have a way of dealing with it since it's just deteriorating the brain. A possible solution for this is have the gut act as the new brain. Why the gut can be considered a new brain is that the gut can already send signals to other parts of the body, just like the brain can impact your mental state, like make you happy, or sometimes it'll make you fall into a depression depending on how well it's taken care of. And the brain, since it's being deteriorated, it needs help in everyday activities. So having the brain have something that helps it would probably make the person's life with Huntington's disease a lot better. How it can become the new brain is it wouldn't do everything that the brain can do because obviously the brain is a lot more specific and it's actually designed to control the body and impact that. But something we could do to make the gut more like the brain and help it can be the brain would be like connect nerves and different things to the gut so it would let it have some of the roles that the brain does normally. And the brain is starting to break down, so the gut would just help it along and do everything like that. It's kind of like someone with crutches. If they break their leg, the gut will kind of be like their crutch, and it'll help them be able to do things in everyday activities. They won't be able to do it as well as someone with a normal, complete, intact brain, but it will at least help them do things. And then that other slide was for the video, which this is, but thank you.